And it's time now for our In Focus Health segment. And of course, we're joined by Linord Moudou. And Linord, you have some interesting details today on malaria.
Absolutely. A researcher at the World Agroforestry Center and the Kenya Medical Research Institute say plants that have been used to treat malaria symptoms in East Africa for hundreds of years are at risk of becoming extinct. One such plant is the African wild olive. Experts say it could disappear. Hundreds of scientists, herbalists, and malaria patients participated in the study. The results were published recently in a book entitled Common Anti-Malarial Trees and Shrubs of East Africa. Nigeria's national coordinator of the Rollback Malaria Program, Dr. Babajide Coker, is calling on all stakeholders in the health sector to work hard to eliminate malaria in the country. He says given the enormous challenges of malaria in Nigeria, everyone must help in the fight, including the government, companies, charities, and individuals. He says health workers should ensure that they educate, treat, and provide necessary attention to those who need their services. Dr. Coker says reducing the impact of malaria is key to achieving the Millennium Development Goals. Now to Cameroon, where advocates are scaling up efforts to help contain malaria in the country. Joining us on the phone from Yaoundé to tell us more is Professor Wilfred Mbacham. He is Executive Secretary of the Cameroon Coalition Against Malaria, an advocacy group. Professor Mbacham, welcome to the program.
Thank you very much, Lina.
First off, can you give us an assessment of, of malaria in Cameroon? What is the situation there?
Well, the situation is such that the prevalence of it is about 11 to 12%. And if you look at those who actually come to the hospital, then it accounts for 40% of the hospitalizations in the different caregiver units. Now, when we went into the assessment of those that actually come to the hospitals with fever, we realized that only 50% of those who are attending the clinics with a fever actually had malaria, which also stresses the need for us to diagnose and then give the appropriate treatment. And so in a way, this is the current situation in Cameroon. And again, just to stress on the burden of disease, that malaria alone eats up 40 to 50% of the household budget, which is already so meager. Therefore, anything that we can do to leave back the money in the hands of the rural poor, then we should bring that.
So obviously, proper diagnosis is really important in finding out that it is, in fact, malaria that needs to be treated. But what are some of the other challenges? How do you, what are the steps that needs to be taken to really contain this disease in your country?
Okay. Well, the first of them is that first we need to improve on our governance structures so that the purchase and the supply would be fluent and it can get to the hinterland. Luckily, with the winning of the Global Fund Round 9, there's a lot of community mobilization to be able to take the treatment nets and the medications to the hinterland where they're needed the most. So they're mobilizing about 15,000 community-based organizations to be involved in this distribution. This is the first of its kind. The other thing we realized was that so many players were on the field and everybody was doing something, but nobody knew exactly who was doing what. So currently, as I speak, I just stepped out of the forum where all the stakeholders, NGOs, government partners, international institutions will come together to actually streamline and to understand who is doing what. I think with that integrated effort, we're going to see a dramatic reduction. The other thing I should mention is that the country has taken on an integrated approach. And so we are also at the same time distributing vet nets and distributing the medications. I'm encouraging people to use this rapid diagnostic test, but also to have other integrated ways, other means of fighting the disease, such as appropriate housing with the properly shielded windows with the nets, as well as taking care of the environment. We saw the coming this week to Cameroon of archives that is doing exactly the housing and environment.
Okay, Professor Mbacham, that's all the time we have for today. Thank you so much for joining us.